What's up, everybody? Very quick. Coronavirus. What's going on with health insurance? I have hundreds of clients right now. I'm getting a ton of phone calls, emails. People are a little bit concerned. Obviously, the sentiment has changed in the last week or two. I think people now have an idea of how serious this is as we're locked in our households for the foreseeable future all across the country. There is a bit of good news when it comes to health insurance. Even plans that are available to you right now today. Okay, so what I mean by right now today, Obamacare or Affordable Care Act compliant plans can only be purchased in November or December, from November 1st to December 15th every year, unless you have a qualifying life event. Right now, a lot of people that didn't have insurance or maybe aren't happy with their plan, there are options available. Okay, there are what we call non-ACA options available to you. And the great thing about these plans, thanks to the government, with all the type of stimulus they're doing and protections to try and nip this thing in the bud as soon as we can, is that any plan you purchase right now, whether it be a $2,500 deductible all the way up to a $10,000 deductible, any testing related to this virus, which obviously the testing has been expanded every day. More and more people are going to continue to become infected with this thing, as many of you have seen the outlook. But the testing is covered 100%, no matter what. Okay. Now, certain states, even if you decide to stay uninsured, the state Medicaid will potentially help with this. But the underlying risk is if you do or are diagnosed with this virus and then sent to the hospital due to pneumonia that was caused from this, then you're going to have some issues. Okay, because that stuff doesn't necessarily need to be covered, and you could be paying bills for a while. And that goes for anything. I mean, in general, you should always, at the very least, have coverage for catastrophic. And I already received multiple emails because this hasn't fully been passed by the government yet. But I've already received emails from 2 or 3 of the carriers that we work with that do non-ACA plans that all these tests are going to be covered by them regardless. And it's probably going to be a government mandated anyway. So if you need help, you need somebody to talk through this whole thing. If you're a little bit worried, maybe if this whole virus has just piqued your interest and put a little bit of a fire under your butt when it comes to not going with insurance or rolling the dice, just call me. I have access to every plan in your state, and we'll make sure we do its best. You give me a call on my cell, 708-566-6589, or shoot me a message anytime, and we will make sure we do its best. Everybody stay safe.